Atypical pneumonia, also known as walking pneumonia, is a diverse group of lung infections caused by various agents. It presents differently from typical pneumonia and requires different diagnostic and treatment approaches. This video provides a comprehensive exploration of atypical pneumonia, covering its clinical manifestations, challenges in diagnosis, pathogenesis, immune response, radiological patterns, antibiotic resistance, molecular diagnostics, viral causes, ICU management, non-infectious factors, and long-term effects. This will enhance your understanding of this interesting aspect of pulmonology. Mycoplasma pneumoniae is a common cause of atypical pneumonia. Symptoms include cough, sore throat, and low-grade fever. Diagnosis is challenging due to nonspecific symptoms, but various tests such as serological and nucleic acid amplification techniques can aid in identification. Chlamydophila pneumoniae is an intracellular bacterium that causes atypical pneumonia. It infects the respiratory tract, leading to various clinical presentations. Understanding its pathogenesis is important for developing treatments. It evades the immune system, leading to chronic inflammation and potential cardiovascular implications. Legionella pneumophila is the causative agent of Legionnaire's disease, a severe form of atypical pneumonia. This bacterium thrives in water sources, such as cooling towers and plumbing systems, and is transmitted to humans through inhalation of contaminated aerosols. Certain risk factors, such as advanced age, immunosuppression, and smoking, increase susceptibility to Legionella pneumophila infection. Timely diagnosis is critical, as delayed treatment can lead to severe complications and high mortality rates. In this section, we will explore the various diagnostic modalities available for identifying Legionella pneumophila and discuss treatment strategies, including the use of antibiotics and supportive care. Co-infections, whereby multiple pathogens infect the lungs concurrently, are not uncommon in atypical pneumonia. These co-infections can significantly impact disease severity, clinical outcomes, and treatment approaches. We will delve into the different microbial combinations seen in atypical pneumonia and discuss the challenges they pose in terms of diagnosis and management. We will also explore the potential synergistic or antagonistic interactions between pathogens and their implications for disease progression. Radiological imaging plays a paramount role in the diagnosis and monitoring of atypical pneumonia. Unlike typical pneumonia, atypical pneumonia often presents with subtle radiological findings that can be easily overlooked. We will comprehensively analyze the range of radiological patterns seen in atypical pneumonia, including interstitial infiltrates, nodules, atelectasis, and pleural effusions. Understanding these patterns will aid clinicians in making accurate diagnoses and providing optimal patient care. The emergence of antibiotic resistance in atypical bacteria poses a significant challenge in the management of atypical pneumonia. Mycoplasma pneumoniae, Legionella pneumophila, and Chlamydophila pneumoniae have exhibited varying degrees of resistance to different antibiotics. We will explore the current trends in antibiotic resistance, the underlying mechanisms responsible for this resistance, and its implications for the treatment of pneumonia caused by these atypical bacteria. Additionally, we will discuss strategies for combating antibiotic resistance and the importance of judicious antibiotic use. Traditional diagnostic methods for atypical pneumonia, such as culture and serology, are time-consuming and often lack sensitivity and specificity. Molecular diagnostic techniques have revolutionized the identification of atypical pathogens by allowing rapid and accurate detection of their genetic material. We will delve into the advancements in molecular diagnostics, including polymerase chain reaction, PCR, multiplex PCR, and next-generation sequencing, and discuss their clinical utility in pneumonia cases. Additionally, we will explore the challenges and limitations of implementing these techniques in routine clinical practice. The host immune response plays a critical role in determining the severity and outcome of atypical pneumonia. Dysregulation of immune responses can contribute to prolonged inflammation, tissue damage, and poor clinical outcomes. We will explore the immunological basis of atypical pneumonia, including innate and adaptive immune responses, immunopathology, and potential immunomodulatory therapies. Understanding the intricate interplay between pathogens and the host immune system will pave the way for novel therapeutic interventions. While bacterial pathogens often dominate discussions on atypical pneumonia, viral etiologies should not be overlooked. Viruses such as respiratory syncytial virus, RSV, influenza, parainfluenza, and adenovirus can cause atypical pneumonia, particularly in certain populations. We will explore the diversity of viral pathogens associated with atypical pneumonia and discuss their distinctive features, diagnostic challenges, and management considerations. This section aims to broaden your understanding of the infectious etiologies of atypical pneumonia beyond bacterial causes. In the video, we will address the unique challenges of diagnosing and treating atypical pneumonia in the ICU. We will also discuss the potential complications associated with this condition and their management. Atypical pneumonia can also be triggered by non-infectious factors, including inflammatory and autoimmune conditions, as well as exposure to certain environmental agents. We will provide an overview of the common non-infectious causes of atypical pneumonia, including hypersensitivity pneumonitis, drug-induced lung disease, connective tissue disorders, and exposure to toxic substances. Understanding the diverse etiologies of atypical pneumonia is crucial in order to formulate appropriate diagnostic and therapeutic strategies. Atypical pneumonia can lead to long-term complications and sequelae that impact lung function and overall quality of life. We will explore the various sequelae associated with atypical pneumonia, such as bronchiectasis, fibrosis, and airway hyperresponsiveness. Understanding the mechanisms underlying these complications will allow us to develop effective management strategies aimed at preserving lung function and improving patient outcomes. Atypical pneumonia includes various infectious and non-infectious causes, making it challenging to diagnose and treat effectively. As medical professionals, it's essential to stay informed on this complex condition for better patient care.